Welcome, nursing students. I'm Professor Rivera-Mitu, and today I'll be sharing high-yield, clinically relevant test-taking strategies designed to help you succeed on NCLEX and classroom exams. These techniques are especially useful when tackling next-gen NCLEX-style questions. We'll go through prioritization, pathophysiology cues, drug mechanisms, and core frameworks like ABCs and Maslow. Plus, I'll include sample questions after each tip to help you apply what you've learned. Let's is one of the most high-yield skills for both the NCLEX and real-world nursing practice. On exams, you'll often face scenarios where multiple abnormal findings are presented, and your job is to determine which one needs attention first. To help with this, think in three urgency levels. Emergent, which is immediately life-threatening. Urgent, something that can escalate quickly if not addressed. Or standard or routine, which can be managed later without imminent risk. Here's how to apply it in test questions. You want to start by identifying abnormal values. Ask which finding is furthest from the patient's baseline or the normal range. Use the 20% rule. Any vital sign that changes more than 20% from the patient's baseline or from normal, if no baseline is given, is usually considered clinically significant. Choose the most abnormal or dangerous change. For example, if you're deciding between a systolic blood pressure of 180 or a heart rate of 110, the systolic blood pressure of 180 is more concerning. While a heart rate of 110 is mildly elevated, a blood pressure of 180 systolic could indicate hypertensive crisis, increasing the risk of stroke or organ damage. So always ask yourself, which one of these could harm the patient first if I do nothing? This mindset helps you think like a triage nurse, which is exactly what the NCLEX wants to see. Let's walk through a high-yield NCLEX-style question focused on airway assessment in a post-op patient. This is a multiple response type NCLEX question. Which findings indicate an immediate airway concern in a post-op patient? Select all that apply. Before we even go into the options, note the keywords that might help you in the stem of the question. You want to pay attention to where it says which findings, which means that it's more than one. And it says immediate, which is the topmost concern, the most urgent or emergent concern. The options are stridor, drowsiness, oxygen saturation of 88%, productive cough, or E, tripod positioning. Take a moment to think this through. Pause the video now and decide which answers you would select before I reveal the rationale. And the correct answers are A, C, and E. Let's break it down using clinical reasoning and airway prioritization. So letter A, stridor, is correct. This is a high-pitched inspiratory sound often associated with airway obstruction, such as laryngeal edema or foreign body aspiration. In a post-op patient, this could signal laryngospasm or swelling, an immediate threat to oxygenation. This is always a red flag. Letter B, drowsiness, is incorrect. While drowsiness can be a sign of hypoventilation or opioid sedation, it is a non-specific symptom. It's worth monitoring, but not an immediate airway emergency unless it progresses to decreased level of consciousness or increased respiratory rate or low respiratory rate. Letter C, oxygen saturation of 88%. This is correct. This indicates hypoxia. An SpO2 under 90% is always concerning, especially in a post-op setting. It may reflect impaired gas exchange, atelectasis, or obstruction. This requires urgent intervention, such as oxygen repositioning or something else. Letter D, productive cough. This is incorrect. A productive cough alone is not necessarily an airway emergency. In fact, being able to cough suggests that patient has an intact airway and can clear their secretions. This is a protective mechanism, not a failure. Letter E, tripod positioning is correct. Tripod positioning is a compensatory posture seen in respiratory distress. What this means is that the patient leans forward, supports their arms, and tries to improve ventilation. This is a classic sign of dyspnea or respiratory failure. For a final clinical tip, when prioritizing post-op airway concerns, look for signs of obstruction, such as stridor tripoding, hypoxia, which is low SpO2, or increased work of breathing or abnormal positioning. Avoid getting distracted by nonspecific findings like drowsiness or normal compensatory signs like a productive cough. This question aligns perfectly with the ABCs of nursing that we always study. A is for airway, which is the stridor or tripod. B is for breathing, which is the low SpO2. Remember to always protect the airway first. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe to my channel, and share it with your fellow nursing students. Your support helps me reach more students and provide valuable content. Remember to subscribe to my channel to be the first to know about more test-taking strategies and concept map videos for different diseases. Remember, together we can make a difference in our nursing journey. Until next time, this is Professor Rivera-Mitu. Stay curious, stay compassionate, and keep learning. See you next time.